You want to get smart, fast, and that's exactly why you're tuning in. Today we're doing a deep dive into something maybe not on your everyday radar, but, well, it could be really important for your pet's histoplasmosis in dogs and cats.
Exactly. We're digging into the key stuff from canine and feline histoplasmosis management. The goal is to give you a really solid handle on this fungal infection. You know, what it is, how it affects dogs versus cats, and what the treatment looks like, all without getting bogged down.
Yeah, and what struck me right away is, like you said, you don't hear about it constantly, but it's definitely linked to certain places, certain environments. And how it shows up in cats can be really different from dogs. Okay, so let's unpack that. What exactly is this thing, Histoplasma capsulatum? How does it actually, infect pets?
Right. So Histoplasma capsulatum, it's a fungus, lives in the soil, and it's what we call dimorphic, meaning it exists in two forms. There's a mold form, kind of filamentous out in the environment. Then there's a yeast form, which is what happens once it gets inside an animal's body.
Okay, two forms. And the mold form likes specific soil.
Yeah, it really thrives in soil that's enriched with bird or bat droppings. So think like old chicken coops, bird roosts, maybe caves with bats, that sort of thing.
Ah, okay. So if you have a dog that loves sniffing around places like that, potentially a risk.
That's where the exposure risk goes up, yes. The mold form produces these really tiny infectious bits called microconidia, spores, basically. The main way pets get infected is just by breathing these spores in.
Just inhaling them.
Yep. Once those spores get into the warm, moist environment of the lungs, they change. They morph into that yeast form, and that's the form that can multiply and cause problems.
And then the body tries to fight it off, I assume?
Exactly. The pet's immune system kicks in. Those yeast cells usually get swallowed up by immune cells. We call them mononuclear phagocytes. Kind of like the body's first responders trying to contain an invader.
Okay.
But here's the catch. Sometimes these immune cells, now carrying the fungus, can travel. They can get into the bloodstream or the lymphatic system. And that's how the infection can spread from the lungs to other parts of the body, becoming systemic. Wow.
Okay.
There's also a possibility, maybe less common, of infection if an animal actually eats the fungus, like ingesting contaminated soil.
Right. So just being exposed, like sniffing around that kind of soil, doesn't automatically mean your pet gets sick?
Not at all. That's a really key point. The animal's immune response is huge here. Probably many, many animals get exposed, especially in those endemic areas we'll talk about. But their immune systems fight it off effectively. They might have a really brief, maybe totally asymptomatic infection that just clears up on its own. No big deal.
So what makes the difference between that and actual clinical disease?
It often comes down to factors that might weaken the immune system. Things like being very young or very old, maybe stress, or having another underlying illness already, that can tip the balance.
Okay, that makes sense. Now, you mentioned earlier that histoplasmosis can look different in cats and dogs. Can you elaborate on that? How does it typically present in each?
Yeah, the main target areas tend to differ. In cats, the infection usually starts in the respiratory tract, lungs, airways. That's pretty typical. But from there, we often see it spread. Bones, bone marrow, liver, spleen, skin, lymph nodes. Those are fairly common sites in cats. Less often maybe the intestines, eyes, kidneys, adrenal glands, sometimes even the brain. But respiratory is often primary.
Okay, respiratory and then potentially spreading out. And dogs, you said it's different.
With dogs, it's often the gut. The intestinal tract is actually the most common site we see affected. After that, yeah, liver, lungs, spleen, lymph nodes are frequently involved too. Similar to cats, places like bones, bone marrow, kidneys, adrenals, mouth, eyes, testes. Those are less frequent targets in dogs.
So while both might cough, you're saying chronic diarrhea, gut issues, that's a really big flag for histo in dogs specifically.
Exactly. That intestinal involvement is a major feature in dogs, much more so than in cats typically.
That is a really important difference for owners and vets to keep in mind. Okay, so geographically, where is this fungus a bigger concern? You mentioned bird and bat choppings. Are there specific hot spots?
Yes, definitely. There are well-known endemic areas in the U.S. Think major river valleys, the Ohio, Missouri, Mississippi, Tennessee, and St. Lawrence rivers. Those are classic areas. But it's also found quite a bit in Texas, the southeastern states, around the Great Lakes, and even parts of California.
So pretty widespread, actually.
It is. In fact, histoplasma has actually been isolated from soil samples in something like 31 continental U.S. states.
Yeah.
So it's around more than you might think, even outside those main endemic zones.
Wow.
So for people living in these areas, yeah, maybe be a little more aware. Disturbing soil, like digging in the garden, cleaning out old sheds or chicken coops, especially where birds or bats hang out, those activities could stir up spores.
Maybe wear a mask for those kinds of chores.
It's not a bad idea, especially if it's a dusty job in a known high-risk spot.
And you mentioned indoor cats earlier. Could they still be at risk? How?
Yeah, it's thought that maybe contaminated dust or soil could potentially be tracked into the house on shoes or clothing, or maybe even through potting soil. It's less common than outdoor exposure, but it's a theoretical risk.
Huh. Something to consider. Now, the article mentioned something fascinating, that tissue samples from, like, almost half of stray dogs and cats in endemic areas tested positive for histoplasma.
Yes, that suggests exposure is really common in those regions.
But clinical disease is much less common, right? So that links back to the immune system fighting it off most of the time.
Precisely, widespread exposure, but thankfully much less widespread illness.
Okay, so if an animal does get sick, what are the actual signs an owner should be watching for? Let's start with cats. What does it look like?
In cats, it often starts subtly, kind of creeps up over days or weeks. The things owners most often report are poor appetite, anorexia, weight loss, and trouble breathing, what we call dyspnea.
Difficulty breathing, okay.
Sometimes you might see coughing, though maybe not as often as the dyspnea. Lameness is possible if the bones are involved, maybe some eye discharge, or even diarrhea, though less common than in dogs.
And what might a vet find on examination?
They might find a fever, sometimes pretty high, like up to 104 Fahrenheit. Definitely signs of increased breathing effort, maybe harsh sounds when listening to the lungs. Pale gums are common, indicating anemia. Enlarged lymph nodes. And then less frequently, yes, you might see that lameness, obvious changes in the eyes, or even skin lesions. Catching those subtle signs early is really helpful.
And for dogs, with that gut involvement being key, what are the big clues there?
Right. For dogs, the most frequent things owners notice are weight loss, just seeming depressed or having low energy, and diarrhea. Often the diarrhea comes with straining, what we call tenesmus.
Training, okay.
They might also cough, show difficulty breathing, or maybe just tire out more easily on walks, exercise intolerance. Enlarged lymph nodes are common here too. Less often you might hear about lameness or changes to the eyes or skin, similar to cats, but less frequent.
And on the vet's exam for a dog?
Affected dogs are often very thin, sometimes even emaciated. Fever is common, again, up to around 104 degrees Fahrenheit. Vets very often feel an enlarged liver and spleen that's hepatosplenomegaly. Pale gums again, suggesting anemia. Occasionally, you might see jaundice, that yellowish tinge or fluid building up in the belly, which is called ascites.
Okay.
Respiratory signs like coughing and dyspnea with harsh lung sounds can certainly be present, but maybe not as consistently the primary sign as in cats. And again, those eye and skin changes are noted less commonly.
Gosh, the signs are quite broad, aren't they? Especially the early ones, like weight loss and low energy, could definitely be mistaken for other things.
Absolutely.
So how do vets actually narrow it down and say, yes, this is histoplasmosis? It sounds like diagnosing it could be a bit of a challenge.
It definitely can be. That non-specific nature of the early signs means the differential diagnosis list, the list of other possible causes can be pretty long. Well, for a cat with breathing issues, you're thinking about heart failure, asthma, maybe certain types of pneumonia, even lymphoma. For a dog with that chronic diarrhea and weight loss, you've got to consider things like inflammatory bowel disease, maybe intestinal parasites, other infectious causes, even certain cancers. So yeah, ruling other things out is a big part of it.
So lab tests must play a big role then. What clues can you get from blood work?
They're very important. A complete blood count, or CBC, often shows a moderate to severe anemia. And typically, it's what we call non-regenerative, meaning the bone marrow isn't responding properly to produce new red blood cells. That's quite common.
Okay, anemia. What about white blood cells?
Usually the total white blood cell count is actually normal,
Okay.
but you can see variations. Sometimes it's high, sometimes low. But here's something really interesting. Sometimes you can actually see the tiny histoplasma yeast organisms inside certain white blood cells, neutrophils, and monocytes when looking at a blood smear under the microscope. They look like little round things, about 2 to 4 micrometers, with a dark center and a lighter halo.
Wow, you can actually see the fungus in the blood.
Sometimes, yes. It's not found in every case, but when you see it, it's obviously very suggestive.
What about chemistry panels? Liver, kidneys.
Yeah, if the liver is significantly involved, which it often is, especially in dogs, you might see high bilirubin levels leading to that jaundice and elevated liver enzymes like ALT. And in dogs with really severe intestinal disease causing protein loss, the total protein level in the blood can be quite low.
Okay. Are there specific tests for histoplasma itself, like antibody tests?
There is an antibody test. It's called an AGID test. It looks for the body's immune response to the fungus. A positive result helps support a diagnosis, but it's not perfect.
Why not?
Well, you can get false positives. An animal might have been exposed in the past, fought it off, but still has lingering antibodies, even though it's not actively infected now.
Ah,
And you can also get false negatives. An animal might be truly infected, but maybe hasn't mounted a strong enough antibody response yet, or maybe the immune system is overwhelmed. So the test comes back negative, even though the disease is present.
so helpful but not definitive on its own. What about antigen tests? You mentioned those earlier.
Yes, antigen testing is becoming much more widely used and is generally considered more accurate for diagnosing active infection. These tests look for actual pieces of the fungus, the antigens, rather than the body's response. There's a urine antigen test that's particularly useful. Seems to be quite sensitive, especially in cats. Miravista Diagnostics, that's www.miravistalabs.com. They offer this testing.
Okay, urine antigen test. That sounds promising. Any other odd lab findings?
Sometimes, though not commonly, you might see a positive Coombs test. That's a test usually used to diagnose immune-mediated hemolytic anemia, where the body attacks its own red blood cells. It's thought that maybe some cross-reactivity with the histoplasma antigens can cause a false positive on that test occasionally.
Interesting. Okay, what about imaging? X-rays, maybe ultrasound? What can they show?
Imaging is really helpful. Chest x-rays are key, especially given the lung involvement. In dogs, you often see what's described as a diffuse interstitial to nodular pattern, basically widespread hazy areas or small spots throughout the lungs. You might also see enlarged lymph nodes in the chest, the tracheobronchial ones. Sometimes they get so big they can actually compress the windpipe, the trachea. And older chronic lung lesions can sometimes become calcified, appearing as dense white spots that could even be mistaken for tumors sometimes.
And in cats, is it the same picture?
Usually a bit different in cats. They typically show more of a diffuse interstitial pattern, that hazy look, but significant calcification. And those enlarged chest lymph nodes are actually uncommon in cats with histo.
Okay. What about abdominal imaging, especially for dogs with the gut issues?
Right. Abdominal x-rays or ultrasound in dogs might show that enlarged liver and spleen. We talked about hepatosplenomegaly. You might also see enlarged lymph nodes within the abdomen, particularly the mesenteric ones that drain the intestines, and possibly signs of fluid, that ascites.
And bone involvement. You mentioned that can happen.
Yes. If bones are affected, which happens in both species but may be more noted in cats, x-rays typically show osteolytic lesions. That means areas where the bone is actually being destroyed by the infection. These lesions are often found on the bones of the lower limbs, like distal to the elbows and stifles knees.
So imaging gives a lot of clues, points you in the right direction, but the absolute confirmation comes from actually finding the organism itself.
Exactly. The definitive gold standard diagnosis relies on identifying the histoplasma organism. You can do this through cytology, looking at cells collected by fine needle aspirates under a microscope, or histopathology, which is examining a stained tissue biopsy sample.
Where do you get these samples?
Samples from enlarged lymph nodes or biopsies of the liver or spleen often have the highest yield, the best chance of finding the organism. Rectal scrapings can sometimes be useful, especially in dogs with intestinal disease. Bone marrow aspirates too. Lung aspirates or washes from the airways like tracheal washes can also be tried, but the results are maybe a bit more inconsistent.
And culture. Can you grow it?
You can culture the fungus from tissues, yes, but it can take time and require special handling in the lab because it can be a hazard.
So finding the organism directly is key. But you mentioned the urine antigen test is highly sensitive.
Yes, that urine antigen test is proving to be a really valuable, non-invasive tool that often correlates well with active disease, especially when other methods are less fruitful or riskier to obtain.
Okay, so once it's confirmed, what's actually happening inside those affected tissues? What do the lesions look like microscopically?
The hallmark is what's called multifocal granulomatous inflammation. Basically, the body tries to wall off the fungus by forming these organized clusters of immune cells called granulomas. You find these granulomas scattered throughout the affected organs, especially those rich in immune cells: spleen, liver, lymph nodes, lungs, bone marrow.
And it reflects what we talked about earlier.
Exactly. In dogs, you often see this primarily in the gut wall and associated lymph nodes. In cats, it's predominantly seen in the respiratory system tissues.
Right. Okay. We've covered a ton. The fungus, how it spreads, cats versus dogs, where it lives, signs, diagnosis. Phew. Now, the really crucial part. What do we do about it? How is histoplasmosis treated?
Treatment usually involves long-term antifungal medication. For many stable pets, especially if their gut is working reasonably well, outpatient treatment with an oral antifungal, usually itraconazole, is the way to go.
Oral itraconazole. Okay. What if the pet is really sick, especially those dogs with severe gut problems?
For dogs with severe intestinal disease, where they might not be absorbing oral meds properly, initial treatment might need to be more aggressive. That often means hospitalization for intravenous or IV antifungal medication, typically amphotericin B.
Amphotericin B, that sounds intense. Are there special precautions with that one?
Yes, amphotericin B can be tough on the kidneys, so it's really critical that animals receiving it are kept well hydrated, usually with IV fluids. This helps protect kidney function.
Makes sense. What about nutrition for these really sick, thin animals?
Good question. For those severely emaciated animals with malabsorption due to gut disease, sometimes we need to provide nutrition intravenously as well. That's called total parenteral nutrition, or TPN. It bypasses the gut completely until it starts healing.
And if breathing is a major issue,
Then oxygen supplementation is vital, and we definitely recommend restricting activity, especially in dogs, to reduce oxygen demand while the lungs recover.
and diet in general.
Regardless of the specific treatment, a good quality, highly digestible, and palatable diet is always recommended to support their nutritional needs during recovery. Make it easy for them to eat and absorb.
Okay, what about talking to the owners? What do they need to know? Besides the treatment plan, obviously.
Client education is huge. We need to talk about those potential environmental exposure areas like we discussed, but maybe most importantly, reassure them.
Reassure them about what?
Reassure them that their infected pet is not contagious. They aren't going to catch histoplasmosis from their dog or cat. That's a common worry. But the yeast form in the animal isn't the form that's typically transmitted.
That's a really important point for peace of mind. Okay, let's talk specifics on the drugs. Itraconazole, you said that's the common oral one. How is it typically used?
Right. Itraconazole is often the drug of choice if the animal can take and absorb oral meds. The usual dose is around 5 milligrams per kilogram of body weight given by mouth twice a day. And it's best given with a fatty meal that actually helps increase its absorption significantly.
Good tip. Any catches with itraconazole?
One thing to be aware of is compounded itraconazole. Sometimes liquid or capsule forms made by compounding pharmacies can have variable absorption and effectiveness compared to the commercially manufactured approved products. So, using the official veterinary product is generally preferred if possible.
And how long is the treatment?
It's long. A minimum of 90 days is usually cited, but often it's much longer, like 4 to 6 months or even more, depending on the severity and how the pet responds. You treat until the signs are gone, and ideally for a month or so afterward.
Wow, okay, months. And amphotericin B, when is that IV right really necessary?
Primarily for those dogs with severe inflammatory bowel disease caused by the histo, where they have profound malabsorption. The IV Ampho B can help get the fungal load down quickly while the gut heals. Once the dog starts gaining weight and improving, you can usually transition them over to the oral itraconazole to continue treatment long term.
And you mentioned hydration is key with Ampho B. Any other specifics?
Yes, proper dilution is important. It has to be diluted in 5% dextrose solution, not saline or other electrolyte fluids, as that can cause it to precipitate. It's usually given intravenously every other day, so maybe Q48 out. The dose might range from 0.5 to 1 millikilogram for dogs, and it might need adjustment if there's any kidney compromise.
In cats, can they get Ampho B?
They can, but you have to be much more cautious. Cats seem more sensitive to the kidney toxicity, so if used, it's at a lower dose, maybe 0.25 milligrammes given IV very slowly over several hours, also diluted in dextrose every 48 hours. It's used less often in cats than itraconazole.
Are there other antifungal options besides these two?
Yes, fluconazole is another one. It might be considered, especially if the infection involves the eyes or the central nervous system, because fluconazole gets into those areas better than itraconazole does. It could also be an alternative in dogs if amphotericin B really can't be used for some reason. It can be given IV initially, then potentially switch to oral.
Okay. Are there times when these drugs absolutely shouldn't be used? Contraindications.
Well, amphotericin B needs extreme caution or might be contraindicated in patients who already have significant kidney disease, azotemia. You have to weigh the risks and benefits very carefully and monitor kidney values like creatinine constantly if you do use it.
And other precautions. You mentioned steroids earlier.
Right. Using steroids, like prednisone, is generally discouraged because they suppress the immune system, which can allow the fungal infection to worsen. There might be very rare specific situations like life-threatening respiratory inflammation where a very short course might be considered, but it's generally avoided.
What about side effects from itraconazole or fluconazole?
The main concern with the azole antifungals like atraconazole and fluconazole is potential liver toxicity. It's not super common, but it can happen. So monitoring liver enzymes like ALT in the blood is important during treatment.
How often?
Typically recommended monthly while they're on the medication. If the enzymes climb significantly or if the pet loses its appetite, you might need to temporarily stop the drug or reduce the dose. Also, atraconazole can interact with other drugs because it affects liver enzymes involved in drug metabolism, so the vet needs to be aware of all medications the pet is taking.
Okay, so ongoing monitoring is crucial. What does that typically involve besides the liver enzymes?
If there was lung involvement initially, follow-up chest x-rays are important, maybe every 60 days or so to see if the lesions are resolving. You continue treatment until the x-rays look clear or at least stable if there's some permanent scarring. And like we said, usually continue meds for at least a month after things look good clinically and radiographically.
Can you monitor those antigen levels you mentioned?
Yes, monitoring the urine antigen levels can also be a useful tool to track response.
Hmm.
Ideally, you want to see those levels decrease significantly with successful treatment and maybe become negative eventually.
What about prevention? Especially for people in those endemic areas. Can anything be done?
The best prevention is really avoidance of those high-risk areas, known bird roosts, old dusty barns, caves, that sort of thing. Trying to minimize exposure, especially activities that stir up a lot of dust in those environments.
Can pets develop immunity?
It's thought that animals, particularly dogs, that recover from histoplasmosis might have some degree of protective immunity against getting infected again, but it's probably not absolute.
Okay. And what about potential complications down the road? Or the overall outlook?
Recurrence is definitely possible. Even after completing what seems like a successful course of treatment, the infection can sometimes flare up again later, maybe months or even years down the line. If that happens, retreatment is needed.
And the prognosis?
The prognosis is generally considered good for animals that are stable at the time of diagnosis and don't have severe, life-threatening respiratory compromise. But it depends on the extent of the disease, especially lung involvement, and the pet's overall condition. It's definitely treatable for many pets, but owners need to be prepared for that long treatment duration, often around 4 months or more.
And the cost?
Yes, the antifungal medications, especially itraconazole for a large dog treated for several months, can be quite expensive. That's definitely a factor owners need to consider. Pet insurance might be something folks in endemic areas think about.
Right. It really sounds like a marathon, not a sprint, treating this.
That's a perfect way to put it. Patience and persistence are key.
Okay, so let's try to pull this all together. Histoplasmosis. It's this fungal infection, really tied to specific environments with bird or bat droppings. It hits cats and dogs differently, often respiratory in cats, more gut-focused in dogs. Diagnosis needs careful workup, clinical signs, lab tests, imaging, and ideally finding the fungus itself or using that antigen test.
And treatment is long, usually months of antifungals like itraconazole, sometimes starting with IV amphotericin B if needed. Cost can be a factor. But the outlook for many pets is actually pretty positive with proper treatment.
And it really drives home that point about exposure versus disease. Just because the fungus is around doesn't mean every pet gets sick. The immune system plays a huge role.
Exactly. Exposure is likely common in some areas, but clinical illness is thankfully less so.
You know, this whole conversation about a fungus lurking in the soil, linked to birds and bats, causing different issues in different species.
Mm-hmm.
It really makes you think, doesn't it? Given how common exposure might be
Hmm.
and how it links to these environmental factors, what other everyday things in our surroundings might hold hidden health risks? Not just for our pets, but maybe for us too.
That's a fascinating thought. It definitely highlights the connection between environmental health, animal health, and potentially human health, that whole One Health concept.
Yeah, it certainly makes you look at that old barn or that flock of birds a little differently, perhaps. Food for thought.
Absolutely. It encourages a bit more awareness of the unseen world around us and how it interacts with the animals we share our lives with.